Once more, I differentiate. Light palpation, you just touch. You just touch. Deep palpation, you apply pressure and you make circular motions. You apply pressure and you make what? Circular motions to feel for masses. If you locate a mass, are you with me? You will suspend abdominal examination. You will examine that mass before you continue abdominal examination. Is that clear? As you will examine an abdominal mass, you come to where you located the mass. Let's assume we located the mass here. First, you touch a normal part of the body, you touch the mass, you touch the other part of the body to assess for what? Differential warmth. Already you have checked for tenderness around the abdomen before, but you can still do it again. You touch the mass and look at the patient to see whether there is tenderness. Then the next thing, you feel around the mass to see if you can get around the mass. Is it clear? If you can get around the mass. If you can get around it, you measure in two planes, horizontal and vertical. If you cannot get around it, the much you can palpate, you also measure horizontal and what? Vertical, 2 dimensions, vertical, horizontal. Then after that, you now palpate the mass to check for the consistency. To check for the surface, you just rub superficially like this. To check for the consistency, you dig the top of your fingers into the mass. Is that clear? Then the next thing, you confirm whether this mass is inside the abdominal cavity or is within the anterior abdominal wall. To do that, you ask the patient to place the hands on the chest and you ask the patient to raise both legs up at the same time. Raise both legs up. No, you raise both legs straight up. Okay? Now, when the patient does this, if the mass is in the abdominal cavity, it will become less visible. If it's inside the abdominal cavity, it will become less visible. Why? Because the anterior abdominal wall muscle will contract and push it far inside. But if it is within the anterior abdominal wall muscle, it becomes more visible. Because as the anterior abdominal wall muscle contracts, it makes the mass more prominent. Is that clear? Okay. So, but if you did not find any mass on deep palpation, you go straight to what? You go straight to what? To organ palpation. Now, how do we do organ palpation? We focus on 3 organs. We focus on what? 3 organs. We focus on what? 3 organs. They will only be gen. We focus on 3 organs. The 3 organs are the liver, the spleen, and the kidneys. Those are the organs we routinely examine a routine abdominal examination. The only time you check for any other organ is when they give you a case scenario. Do you understand what I mean? Like they say a patient has obstructive jaundice. You will now deliberately look for the gallbladder. Or a patient that has difficulty with passing urine, you will palpate for the bladder to see whether it's distended. Or a patient that has a gastric outlet obstruction, you will palpate for the stomach and you will check for succussion splash. Do you understand? So we will show all those ones, but first of all, let's do the routine thing. Are you with me? Now, the routine palpation for organ, we start with the liver. We start with what? The liver. If you check for spleen before the liver, you will lose mark because you are not orderly. Examination has a sequence. You are supposed to always follow the sequence. Is that clear? So you check for the liver first. How do we examine for the liver? You use the radial border of your index finger. You place your hand like this in the right iliac fossa. You ask the patient to breathe in and out. When the patient breathes in, you dig your finger in. As he's breathing out, you wait to see if the radial border of your index finger can feel the enlarged liver. Is that clear? So after that, when he breathes in again, you go in. You keep going in until you feel the liver or you get to the right costal margin. If you get to the right costal margin and you cannot feel the liver, it means the liver is not enlarged. But if you do feel the liver, for example, like in this place, you must characterize it. If you feel the liver is enlarged, you must characterize it. There are 3 ways to characterize it. 1, you check for the length from the costal margin. So you come, you take your tape, you check the mid-clavicular portion, you trace it down to the costal margin. Along that mid-clavicular line, you now put your tape from the costal margin at the mid-clavicular line. Are you following? You now take a measurement to up to where the liver was enlarged. And you say the liver is 5 cm below the costal margin. That's the first thing. The second thing, in characterizing it, you now palpate that liver. You check the surface, you check for tenderness, you check the edge to see whether it's smooth. Are you following? You palpate the liver, check the surface, you check for tenderness, you check the edge. The last thing to do to characterize it is to check for the liver span. How do you do that? You come to the chest, to the first intercostal space along the mid-clavicular line. You percuss along each intercostal space until you can hear the hepatic dullness. You mark that place with a Bible. Then you come down to the right iliac fossa. Along the mid-clavicular line, you percuss upward, until you also meet what? The hepatic dullness. You mark it. You now use a tape. You measure between the 2 markings. If what you get is above 10 cm, then the liver span is increased and it confirms that the liver is actually enlarged. But if what you get after percussing